How many prescriptions do you need when you have a total hip replacement? Well, if you're like me, I had not 10, but 11 different prescriptions plus 2 refills on those prescriptions. Hi, I'm Pamela, and I had a total hip replacement almost 3 years ago from the time that I'm creating this video. I had a whole slew of prescriptions from my doctor that I didn't really know what they were for. However, it was very important to him that I actually took them. So in this video, I'm going to go through them with you prescription by prescription, so that way you can know what my doctor prescribed for me. So if you are planning on having a total hip replacement, this might be something similar perhaps to what your doctor might prescribe for you. Now, first of all, I am not a medical professional. I'm just a regular person just like you. Before I had my total hip replacement, I did what you may be doing right now, which is kind of scrolling through YouTube, trying to find information about what is it like to have a total hip replacement. However, all of the videos that I found back then were all from the doctor's perspective. There were very few information that was actually from the patient's perspective. If you have not yet subscribed to my channel, this is a good time to go ahead and do that, because I create new videos on a regular basis, and typically I get my ideas for videos from questions people just like you ask in the comments below my videos. All of the prescriptions that I had, I'm going to let you know right now, chances are really good that I'm going to butcher the pronunciation of most of these prescriptions. Hopefully you'll give me a little bit of grace on that, because I'm not sure how to pronounce them, just because I'm not a doctor and I'm not a pharmacist. The prescriptions came kind of in a couple of different batches. And my doctor, actually it was the physician's assistant that I had my appointment with 2 weeks before my surgery, that individual told me that there would be a whole bunch of prescriptions sent electronically to my pharmacy. I had previously given them the pharmacy contact information, of course. He said the first couple of prescriptions were going to come sooner, and the next batch of prescriptions were going to come just literally a couple of days before my surgery. And that's because those were the prescriptions that were the pain pills, and they want to be sure, apparently, that patients don't decide to take the pain pills for the calming effect in the days before their surgery, because they actually need them after the surgery. So the 2 prescriptions that they prescribed for me kind of early on that I was able to go straight to my pharmacy and pick up and keep at my house were something called Hibiclens and something called, and bear with me on this pronunciation, Mupirocin, something along those lines. So the first one, Hibiclens, it's a body wash that you use. The instructions for me were to take a shower using this particular type of I believe it was an antibacterial body wash, all over my body, including my hair, the night before my surgery, and then take another shower the morning of my surgery, again, using the same antibacterial soapish kind of stuff all over my body and including my hair, so that way my body was ideally as sterile as possible. The other prescription, that was actually kind of like a nasal ointment, and so the instructions were to kind of swab my nasal passages. Again, I believe that was an antibacterial type medication. Now, when my mother had her hip replacement almost 20 years ago, she had these exact same instructions. I knew that being sure that I was following these instructions for these kind of antibacterial medications was really important. When I was a young child, somebody who I knew had gone into, and this was a girl, had gone into surgery for a broken leg or something like that, got an infection at the hospital, and she was laid up for the entire summer. Fast forward to several years ago, a good friend of mine who is a full-blown grown-up like you and me, he had major shoulder surgery. which ended up getting an infection from the surgery at the hospital. And so I was really good about using these 2 prescriptions because I did not want to end up in one of those situations. The next batch of prescriptions were ones that I'm going to kind of call, some people would say that's the good stuff. And so I'm going to go ahead and read to you those prescriptions. The first one was actually an anti-nausea prescription. It's called Ondansetron, something along those lines. Now, comment on this. It's been almost 3 years since then. I don't remember getting that prescription ahead of time. What I do remember was waking up from surgery and being incredibly nauseous, vomiting kind of uncontrollably for probably the next 12 hours or so. I don't recall getting the instruction to use that anti-nausea medication prior to my surgery. I may have taken it when I got home after the surgery. I just don't recall. In fact, when I was looking at the list of prescriptions that I picked up today from my pharmacy, I was actually kind of surprised to see that one was there because I don't remember it. Just wish I had taken it perhaps a little bit sooner. The next prescription I had is Gabapentin. Now, this is kind of interesting for somebody that's had surgery. I asked my pharmacist about this way back when I was recovering from my surgery, and he told me that gabapentin is frequently used for nerve pain and oftentimes for people with perhaps diabetes or some other issue that would give them nerve pain. And so he was actually a little bit surprised that my orthopedic surgeon had prescribed this particular prescription for me after my surgery. I suspect that what they did was they kind of like threw a whole bunch of stuff at me, thinking, okay, well, then I could pick and choose maybe what worked best. And I'll touch on that in just a couple of minutes. The next prescription that prescribed for me was something I was very shocked that this was a prescription, and it was aspirin. Basically what we would consider, certainly in the United States, baby aspirin. And I asked the pharmacist when I picked this up, I'm like, okay, is this the exact same baby aspirin that people who perhaps have heart conditions sometimes like to take every day, or the same baby aspirin that I gave to my son when he was a baby? And the pharmacist said yes. And I said, well, then why do I need a prescription for it? And he said, because your insurance will cover it. And so actually that was true to a large degree. Rather than paying whatever the full retail price was for a 30-day bottle of baby aspirin, I ended up only paying for that particular prescription $1.26. Now, just so you know, if you see me kind of going like this, that's because I've got a big blow up of the prints of this print that I got when I picked up my pharmacy. And I wrote some notes on it to help remind me what some of these prescriptions are for. So the baby aspirin, great. The point of the baby aspirin apparently is to minimize the likelihood of blood clots, which I was also very, very diligent with taking that. My mother, prior to her hip replacements, when she had different surgery earlier in her life, had a blood clot. After her hip replacement, she either had a new blood clot or the one she had kind of reactivated, or maybe it never fully went away. But she definitely was diagnosed with a blood clot after her hip replacement. And because of her history, I was really mindful of being sure that I was doing everything I could to not fall into that same path. The next prescription on the list is Celecoxib. It's an NSAID. Similar to ibuprofen or something along those lines. However, apparently the way it's formulated, it's less likely to cause stomach issues. So that was, I had the aspirin, which probably wasn't for pain because it was baby aspirin, but this one was the first one that was really kind of what I'm going to call true pain, because remember, the gabapentin wasn't necessarily always prescribed for surgical pain. It's more for nerve pain that can happen even if you don't have surgery. The next prescription was Senna Plus, which is basically a stool softener. And this kind of falls into the same category as the baby aspirin. It is essentially the same formulation as to what I could have purchased just retail there at the pharmacy. However, again, my insurance covered part of that. And so for that, the first one I paid $3.32, and then I ended up having to get a refill that I spent 32 cents on. So I was happy at least to have these prescriptions for non-prescription medication. So that way I saved a couple of dollars on my prescriptions. Now, the next one is the big gun, and this is the prescription that lots of people are either looking forward to or are very concerned about. And that's oxycodone / APAP. And what that basically is oxycodone plus acetaminophen. It is stronger than codeine. That is the one that we have a lot of concern about, certainly in the United States, and I believe in other parts of the world also, with addiction problems. So this is the one that definitely knocks the pain out, but I was very concerned about taking this one too long because I was so freaked out about, I don't want to become addicted to my medication. And we'll talk about that in a couple of minutes also. Then the last one that I had that was prescribed for me before my surgery was tramadol, which is a prescription which, according to my research, is opioid-like, but it's a little bit weaker. So with all of these prescriptions, I had several different options for pain. What kind of confused me is when it comes to things like prescriptions, they give me instructions, whatever it is, take one every 4 to 6 hours. Okay, great. I will take it every 4 to 6 hours. But what got a little confusing for me was I had these variety of different pain medications. They all had their individual instructions, but what I didn't get was any type of master instruction list that said, take this first, if it doesn't work, then take this, but don't take this one at the same time as this third one. And that got to be a little bit nerve-wracking for me. In fact, having all of these prescriptions that were supposed to be taken at different times of the day, my partner, Bill, when he was taking care of me, he created this master sheet, and we kind of just checked it off. So that way we knew I'm supposed to take this at 8 a.m., this one at 10 a.m. And certainly for the first few days, where I was kind of in that kind of stunned and wobbly phase right after my surgery, it was really helpful to have that to be sure that I was on track. So at my 2-week follow-up, the PA prescribed 2 more pain medications. One of them was, okay, this is a long one I'm going to totally mess up for you. Cyclobenzaprine. Not sure, I think actually might have gotten that one right. That was a muscle relaxant. And then he also prescribed just straight up oxycodone. Now the first oxy was one that was combined with acetaminophen. This one was just straight up oxy. I don't know why he prescribed something different than the first time around, if it was better, if it was not so good. I didn't have a good feeling about the physician's assistant that I saw in the follow-up appointments. In fact, I created a whole video about that, and I'll put it up in the link above this video. What I ended up doing with those last 2 prescriptions was finding kind of a sweet spot of I took half of one of the cyclobenzaprine and half of an oxycodone and would take those just at night. And I found that that kind of got me to the place where I was able to sleep much more comfortably. Now, I was sleeping so good at that point that I started to get a little bit worried. And so each prescription was only for 2 weeks. I had cut them each in half, so therefore I had four weeks of prescriptions for each of these. And by the time I got to week number 3, I said, you know what, I'm just going to stop taking these. Just because I was so worried about addiction problems. I don't have a history of addiction. However, I know that that's a real slippery slope for people to go to, and I didn't want to go down that slope. So then after kind of that 3 leading into the 4-week phase, I still had the pain at night. I just was kind of getting up and walking around the house to try and relieve some of that pain. At the same time, the physician's assistant prescribed another refill of Gabapentin. And this is another thing where I went to my pharmacist and I said, why am I getting this? And the pharmacist is like, I don't know. It's usually for people perhaps who have diabetes. The other thing that really concerned me about all of these painkillers is when I was having the conversation with my pharmacist about specifically the oxycodone. I said, what other suggestions do you have? I know you definitely can't prescribe things for me, but are there questions that I should be asking my doctor? And the pharmacist just kind of looked at me like I was crazy, and he said, there's nothing to worry about. People take oxycodone, for the rest of their life. And I'm like, but I don't want to be one of those people that has to take oxycodone for the rest of my life. So considering the whole drama with the opioid issues that we have, I was so surprised that my pharmacist was so rather casual about me potentially taking these forever. Now, there was one bonus medication that I took actually about a year and a half after my hip replacement. And I had gone back to the MD. At that point, I refused to see the physician's assistant. I went back to the MD because I was having a lot of pain, which originally I thought was in my hip. Turned out it was actually in my groin. I had that pain before the surgery. It was getting better. The surgery, I think, kind of triggered that pain again. It got better after the course of about 9 months, and then it came back. And that pain was diagnosed by a physical therapist. And so I went back to the MD and said, hey, listen, buddy, I came to you because I had this pain. You gave me a new hip. A couple of years later, I still have the exact same pain that I had before my new hip. So what he prescribed for me at that point was prednisolone, which is a high-powered steroid. And that really had nothing to do with my joints. My joint is perfectly fine, but the muscles kind of surrounding the joint, including in my groin, that's where I was having a lot of pain that went away, came back, and I'm actually still struggling with it now. However, that high-powered steroid definitely wiped out that muscular pain that I was having, which tells me the good thing about that was, okay, so that pain was muscular. It wasn't in my joint. Even though the doctor took x-rays and told me my joint was perfect, that pain has come back. But what it has told me is by managing what I'm eating, by exercising appropriately, I'm able to kind of get that muscle issue kind of a little bit more under control. So those are the prescriptions that I had after my total hip replacement. What about you? Write in the comments below this video and let us know what prescriptions has your doctor prescribed for you if you've already had your surgery, or if you haven't had your surgery, what questions do you have about prescriptions? At the time that I'm creating this video, my channel is still small enough where I can respond to every single comment you write under any of my videos. And again, if you've not yet subscribed, I welcome you to do that and to join the community of people just like you and me who are kind of navigating what it's like to work through life with a total hip replacement. Until next time, take care.